Hi, welcome back to Consider This, Simplifying the COVID Conversation. I'm Heidi Beidinger. Each week we look at the COVID-19 data together here in St. Joseph County, Indiana, and sometimes the broader United States. So let's go ahead and get started. So as you know, each week I present certain data points so that we can track that data together. And on this first chart, you'll see here that these are the new COVID cases that have been steadily increasing since we started looking at this data since early September. The data points are configured on 7-day rolling averages. That's when you take the previous 7 days of new cases, you add them up and divide by 7, and then that gives you the single day, 7-day rolling average for that particular day. So, as I've been reporting almost since the beginning that we started talking about this, you can see that we have just been in this steep incline here in St. Joseph County of just climbing cases, new cases every single day. And now, as of 2 days ago, we are averaging 310 new cases per day here in St. Joe County. Here are the number of active cases in our community. Again, this is for the preceding 14 days, and similar to the new cases, the way we compute this, we look at the previous 14 days, add those up, and then divide by 14, and then that gives us the average for a particular day. So just with the previous, same with the previous trend for new cases, the number of active cases in our community at a given time, we are now at a very steep 4,084 cases. So we have over 4,000 active COVID cases in our community. Percent positivity. This tells you the percent of folks who have taken the test and what percent of them are positive. So again, when we started tracking this data together, we were at about a 6.4% positivity. So that meant for all the people who were taking that test on that particular day, 6.4% of them were coming back positive. We've been tracking this through time, and you can see we had a moderate incline, and now in the month of November, it has significantly gone up so that we now have a 12.3 positivity rate for those folks who are taking the COVID test. The R0 represents the community transmission. Again, this statistic has gone up. We've seen it go down a little bit. We've seen this pretty steady increase, and now we've seen this slight decline. So you might be saying to yourself, okay, on those other charts, you're showing us all of these steep inclines, and particularly with the percent positivity that has doubled just in the month of November. But here we're seeing this slight decline. I want to remind you that the R0 estimate is based on a lot of different factors. There are a lot of variables inside the estimation of this. So while I cannot positively say why there is a decline in here, I can say that this is just one indicator about what is happening in our community, and that it is a difficult statistic to estimate. As I've said each week, as epidemiologists and public health experts, we don't rely on any one indicator. We look to many indicators before we make decisions about our community. So we have our new cases going up. We have our active cases going up. The percent positivity has certainly shown some of the most dramatic increase within the month of November. And then, of course, the community transmission is still above 1, which still indicates that cases are increasing, as is confirmed by the other statistic. And as every week when I talk about this, we talk about the fact that we also want to listen to our community, to hear what the community is telling us about what's happening with COVID. And then that is the time that decision makers, CEOs of the hospitals, a health officer, government officials can then make decisions about what's happening in the community. So let's hear what's happening in the community, because these numbers are rather grim. So this came from today's South Bend Tribune. I'm recording this on November 23rd, 2020, and I took these quotes straight out of the today's Tribune. So the chief clinical officer for Beacon Health System says we don't want to end up rationing care in the hospital. Dr. Dale Patterson, VP of Medical Affairs at Memorial Hospital, says we have to have people to take care of these patients, and we're running out of people. Last week, I talked about that what we were hearing in the community was that we were having healthcare provider and nursing shortages, burnout, and fatigue. Amber Hodges is a respiratory therapist at Elkhart General Hospital, and she says, we don't have enough resources, and we're running out of everything right now. So this sounds back to the times in March and April when we were talking about running out of supplies and having problems with the supply chain. It seems to me this is what she is reporting, that we are running out of resources. Dr. Michelle Bach is the VP of Medical Affairs at Elkhart General. The time to act is now. We really just need something to change. Again, this rather grim statement almost sounds desperate. Chad Towner, who's the CEO of St. Joseph Health System, at the start of the day this morning, we were 11 COVID beds short. So this is something else that we've been hearing in the last couple of weeks, that the capacity of our hospitals is reaching thresholds and even exceeding the capacity to be able to house people who have COVID and to be able to care for others who need hospital resources and services. So these statements are summing up what's happening right now in our community, but also our neighboring communities. This was in the paper just a couple days ago, and this title here, as well as this photograph, are again rather grim, something that's gripping us and that we need to come to terms with. But this is a refrigerated truck that was purchased in that was purchased in April. St. Joe Health Systems purchased that truck in April in anticipation of needing to store the bodies of patients who have died from COVID-19. Memorial Hospital is also looking into purchasing a semi-trailer to be able to do the same thing. So it's just really important, once again, in a very sobering tone, I say this to you. The CDC's recommendations for the holiday season and gatherings: host outdoor activities rather than doing them indoor. Limit your guests to just a few folks who are here in the local area, and limit them to the people who are in your household or who have been in your family pod during these last several weeks. Encourage your guests to wear masks and to use hand sanitizers, and ask guests to strictly avoid contact with people outside of their households for 14 days before gathering. I don't think any of us can be too careful during this time right now. We don't know where COVID is. We don't know where it's coming from. So it's going to be upon us to take these measures very seriously in order to protect ourselves and our family. As always, I include the data sources in case you want to dive more deeply into the data that I've provided here. And as always, please email me at consider@nd.edu. I wish you and your family the safest of holidays, and I will see you in a week. Goodbye.